Kentucky. Okay, sorry. I just heard that we were recording. Great. Love that I'm being recorded. My name is Rebecca Williams. I own a company called Ohana Pet Care in Louisville, Kentucky. We have been doing pet care services, veterinary assistant services for the last several years. And sorry, I'm laughing at your dog jumping behind you. And we are trying to hire a veterinary social worker. And I'm also starting the MSSW program at UT this month with hopes to get the VSW certificate. So this is my first coffee chat with you all, and hopefully the first of many. Nice to meet everybody.
Nice. Yeah, thanks, Rebecca.
I don't mind going next because I'm the newbie to this group. So my name is Rebecca. I'm actually based in sunny Brighton, which is in England, in the UK. Huh. I'm currently working as a lecturer, a senior lecturer in social work over here. I'm also an international consultant working for a company based in Australia, Amavita International, and we specialise in supervision for all professionals. And I'm actually speaking at the summit in October about a supervision model that we developed specifically for vets and veterinary social workers. I have to say, I am so excited to be here because there are no veterinary social workers in the UK, to my knowledge, and it's just an area that I came across over the past year, and just with keen interest have been, following the world of veterinary social work. And I understand that the movement is emerging in Australia as well. So I'm really excited to have joined this cafe today, just to hear more about you and understand more about the work that you do. So that's a little bit about me.
Awesome. Thanks, Rebecca.
I'll go next. So it sounds like the newbies are going first. So I have heard about this association and was waiting for renewal or to join when the dues are due, just to make it easier. I'm Jessica Holton, a clinical social worker with the private practice in Greenville, North Carolina. I run a pet grief and loss support group, and I've attended several trainings dealing with animal-human bond and interactions. And while president of the NASW North Carolina chapter, also helped establish the practice area network that deals with animal-human bond for North Carolina's chapter. And so I'm excited to finally be a member and looking forward to these chats more often.
Oh, cool, Jessica.
I guess I'm also in that newbie category, so I'm happy to go. So I'm Teresa Emery. I'm currently in a friend's camper van while on vacation with COVID. So I am in the state of Vermont currently, which I lived in for about 8 years before moving to Australia for the last 6 months to do vet school, before deciding not to do that and moving back to North America. But I hail from Canada, actually, is where my primary base is. So a little all over the place. And I'm currently actually looking for a job. So I am just to networking with people and kind of exploring that. I'm in the process of getting the veterinary social work certificate. And I've done some work as a veterinary social worker here in Vermont before. So have some background and experience in that as well.
Thanks, Teresa.
I can go. My name is Laura Zmud. Hello, everyone. I am from Saskatoon, Saskatchewan, Canada. This is my first meeting as well. I've heard about the association and kind of known about it for a while, but yeah, this is my first coffee house. I'm a registered social worker. I have a bachelor's degree, and I currently work at the Saskatchewan SPCA. I have experience working at our local vet college in Saskatoon. Not as a social worker, as a veterinary assistant for about 7 years or so. And all of my work, social work or not social work related, has always been around the human animal bond. And yeah, I'm hoping to pursue my master's starting next year to kind of get closer to being able to provide veterinary social work in Canada.
Cool. Thanks, Laura.
So I can go next. I'm Krista Martin. I am a clinical social worker. I'm located in upstate South Carolina, and I am currently the program coordinator for the Veterinary Hope Foundation.
Thanks, Krista.
Hi, my name is Rebecca Reynante. I am a licensed clinical social worker in Virginia Beach, Virginia. And I've spent 14 years working as a school social worker and now branching out in a private practice and exploring the world of veterinary social worker. So I'm just very happy to be here. Thank you.
Thanks, Rebecca.
Okay, I'm Wendy from Holland. It's 2 o'clock in the night here. I'm a little bit sleepy, but I have my holidays, so I thought I can do it. But for the English, it's a little bit. I'm from Holland. Veterinary social work is not existing here, and I want to change it. So I'm already interested. What have I done? In early days, social work. Later on, also assistant in veterinary practice. At the moment, and some other stuff. And now I'm back, and I'm thinking everything is coming together. I'm studying again, and I'm not sure where it's going, but I have some ideas. I think some things in Holland can be a little bit different than in the United States. I was at the conference 2 years ago, thanks to COVID. Some things are good about COVID. Everything is going online, so yeah, that's it.
Great. Well, thanks, Wendy. So I guess both you and Rebecca are night owls for tonight.
Yes,
Thanks
it's
for
quarter
joining us.
past 1 here.
Yeah, thank you.
Here it's an hour later, but it's okay. Thanks.
Alice.
I'll go next. I think, did I just freeze? There I am. Okay. I'm Lisa Weiborg. I'm a veterinary social worker based out of Cleveland, Ohio. And I did my VSW certificate program there with Augusta and Allison. That's how I know them here. That was back in 2018. So it's been a few years since we've, seen each other in person. But I work part-time actually as a human hospice social worker, but then also doing some research projects for veterinary mental health. And I'm actually working with Tom on a project at UT for their veterinary college students, and working on diversity and inclusion and trying to help, improve that as the veterinary college experience. I also have my own consulting agency here in Cleveland. And we kind of just do workshops at different vet clinics, talk about resiliency, and kind of just trying to get the network of veterinary social workers here in Ohio. It's kind of a smaller group, but I think we're growing, and I'm excited to see so many other people who are excited about veterinary social work.
Thanks, Lisa.
I can go next. I apologize. I'm having some connectivity issues, so I think my camera will probably not cooperate. My name's Deborah. I'm a licensed clinical social worker. I am at Dove Lewis, which is a specialty and emergency animal hospital in Portland, Oregon, and I manage the veterinary wellbeing program here, as well as the pet loss support program.
Thanks, Deborah.
I'm Allison, and I went to the program in 2018, and I am affiliated with a private practice and we do animal assisted counseling. And I also do pro bono work for a very small veterinary clinic that I've been affiliated with or gone to for over 25 years. So I work with the staff there as a veterinary social worker, and I am in the process of coming up with a behavior health program, and it's BEE behavior health. I'm a beekeeper, and I am developing this program to work with people for PTSD, whatever kind of mental health issues we have, using bees in mindfulness and purpose in practice in teaching people beekeeping. And so I'm really excited about it. We're getting there. We're getting ready to do a program where we're going to bring in people to other beekeepers and people in the different areas of mental health to decide how we're going to really develop this program. And we have a huge mental health program that is looking for us to come and start with them, and possibly 5 hives at the big mental health program to start the beekeeping. So I'm really excited, and I've joined some of the veterinary programs that are doing veterinarians that are veterinarians for beekeepers, and want to encourage more veterinarians to get involved with bees, because there's a lot of laws that are going through now that beekeepers have to work with veterinarians for our stuff. So, and I'm very intrigued with what's going on in Australia right now with bees finally, the varroa mites coming into Australia. So it's amazing how they are eradicating the bees from us, the varroa mites in Australia, and how we deal with them here in America and the rest of the world. So you want to talk about bees? I'm happy to talk to anybody about bees. They, to me, are just going to be amazing for us in mental health and dealing with stuff. And so that's my thing. And I
Thanks,
also do work with service dogs. That's my other piece of my veterinary social work, helping and advocating with people with their service dogs. So.
And Allison, maybe I missed this. Where are you at? Where are you located?
Oh, I'm sorry. I'm located in Lakewood, Colorado, which is a big suburb of Denver.
Yeah.
I'm a Colorado native. I'm your rare breed here. So,
Yeah. Cool.
Yeah, Colorado.
Great. Thank you. Yeah.
And
Yeah,
I think we
bee-
met in 2018 for our VSW program. I had
Yes.
that big service dog. Dr. Seuss was with me. Yes.
Yes,
So,
yes. Yeah. That's
He's-
cool.
Placed by another Muppet named Obi-Wan Kenobi, who spells his name O-B-E-E as opposed to the Star Wars Obi character. So,
Of course he does.
yes.
Of course.
And neither one of my dogs are obviously allowed to run the beehives because they look like great big huge brown bears, but they represent the bees. So there we go.
Nice. Well, cool. Well, thank you everyone for just taking a few minutes out to introduce yourselves. It's so cool. We could never do this without Zoom, to have people from around the world here. It's just pretty fascinating. I thought what I would do, maybe just to give you a little bit of history about me, is talk about how I came into social work, because I started as a veterinarian, and that'll give you maybe a little insight as to how I ended up here. So I went to vet school at Iowa State University. I was born and raised in Illinois, though. So after vet school, I was a small animal veterinarian in the suburbs of Chicago. I was at a larger practice for about 20 years. And during that time, I actually started a behavior residency. It was a non-conforming veterinary behavior residency. And for that, it allowed me a lot of latitude. And one of the things that allowed me to do was to continue working full time. Part of that residency program was that I ended up, instead of having behavior clients come see me, I ended up going out to them in their homes. And so I did that for 12 years, actually. And so shortly after I started the home visits, I actually became quite fascinated and started appreciating the honor and the privilege of these families inviting this stranger into their homes to talk to them about the problem behaviors that their dog or the cat was having. And I would have to pinch myself many times because I became so fascinated with the family dynamics, because these folks would just continue with their normal family lives as I was trying to go down this checklist of asking questions about the dog or cat. And so kids would be getting ready for school, running up and down the stairs, yelling, and moms and dads would be trying to get to work or coming home from work or trying to make dinner. And I was just dropped in the midst of it all. And I started realizing that as a veterinarian, for sure, I could give them information about their dogs, but I was also seeing things going on in the family that is like, oh boy, you know what, that's a problem right there. But as a veterinarian, I didn't have the license to really talk to them about family dynamics. And I just didn't feel like I had to really walk on eggshells when I was talking to them about their family and their interactions with their pet. So jump ahead. After 20 years of being at this practice, I decided to go off on my own. I didn't know what the owner was going to do, and I jumped ship before he sold the practice. And so I bought a one doctor practice. It was just me, and I had that for 5 years. And during that time, that was a 24/7 job. It was, I was literally everything from the kennel kid on the weekends to the veterinarian to the emergency tech to the one coming in the middle of the night to treat animals. And while it allowed some flexibility, I was able to proudly attend all of my two sons' high school events, sporting events. I was done with veterinary medicine. I was just done. And yet I was torn because I didn't want to give up this, all this work that I had done. So because of that position, I ended up I was not able to complete my residency in animal behavior, though I did accumulate this wealth of appreciation for families. I sold the practice and I started working as what's called a relief veterinarian. So it's kind of like a substitute teacher. I just went around to different vet clinics and I filled in here and there. And again, that in and of itself was pretty fascinating because I would see all these social dynamics going on with clients and veterinarians and technicians and staff. And yet I still couldn't really do anything, but it was just fascinating. And at the same time, there were some really tragically, there were some really well-known veterinarians who ended up dying by suicide. And that really struck me because I knew these folks. And so I was really just in this place of, I don't know what to do with my life. And what I ended up doing then was realizing that if I became a social worker, one, I could help veterinarians with mental health, including my own. Two, it would give me some sort of license, some knowledge to talk about families and their dynamics as it relates to animal behavior. And three, it would give me something else to do, honestly. And so I love going back to school. And so I went to Loyola University in Chicago. I did that for 2 years. I was full-time, worked part-time. And within a few months of graduating, this position over here at UT popped up. They were looking for a social worker for their veterinary social work program. And if you were a veterinarian, that was bonus. And so I applied, and after about a year, I ended up getting that position. So I think I've got the best job in the world, at least for me, because what this position allows me to do is I negotiated a little bit, but I wanted to make sure that I still continued working as a veterinarian. I didn't want to give up those skills and knowledge. And there's a camaraderie amongst us veterinarians. And then the other awesome thing is that I knew I was going to be able to work with college students, veterinary students, as a veterinarian, and then even more importantly, as a social worker, to help them develop skills that will not only help them in vet school, but would help them once they graduate from vet school in their personal lives and their professional lives. just because as you know, veterinarians are just, we're dropping out of the profession really quickly. And it's pretty sad for all the dreams and, and goals and money. And within 5 to 10 years, folks are just leaving. And so I have the ability then to work with those folks. So that's a little bit about me. And I wasn't sure where we wanted to go with this conversation. I would for sure entertain questions, and I'd love to hear how you folks are able to bring it down to like this conversation, how you're able to help veterinarians, or wondered what situations, either challenges or really rewarding situations that you have that just maybe small little bits at a time, but that you're seeing that it's making a significant change in someone's life.
I think one of the things that I've been seeing from being in this field for a few years is seeing the vets transition to becoming social workers. And I feel like I love it because I think that when vets can you hear me now? Yes.
Yes.
Okay. You certainly can. Thank you, Laura. It switched on me. So one of the things that I've seen from being in this field is veterinarians transitioning to being social workers. And I think that it's a really great thing because there's more
We're kind of losing you again.
I'm just taking out my headphones completely.
There we go.
just be done with the headphones.
That's better.
I think my kid's in bed now. So one of the things that I've been seeing is veterinarians transitioning to being social workers. And I think it's a really great skill set because just from my personal experience, there's been more buy-in from veterinarians and their staff when there's a social worker that has the animal background. I didn't know if, especially since there's so many new potential VSWs here tonight, if you have any experience or feedback of how to make it a social worker more palatable to a veterinarian and their staff when they don't have any animal background. I freeze.
No. I guess do you mean trying to, if somebody doesn't have a VSW in their clinic?
So for people that don't, for social workers that want to get into this field, but don't have that animal background, that have never worked in an animal shelter or have never been in a vet hospital, and want to do the social work with a VSW as a VSW.
I've worked in several clinics and with a mobile veterinarian, and this was before veterinary social workers were even thought of. And so I don't really know how they would react at the time to bring in even a veterinary social worker with experience. But I feel like in a hospital setting, veterinarians or veterinary hospital owners I don't think they're going to be very open to people with no experience because it's such a big part. If you're going to be working in a clinic, you should at least have some experience with the goings on in a hospital, even just the basics. So I don't know. I think that it would be a prerequisite. to have at least some level of experience.
I think also, in my experience, it depends what your role is going to be in the hospital. When I was working as a veterinary social worker, a lot of my role was grief counseling and working with families like in the euthanasia process and going through that. And I already had experience working in a veterinary clinic as a technician, and so that was not a foreign experience to me, but I can imagine, and my feeling having worked in the field is that like a lot of veterinarians hold that process, and so just having that understanding and that knowledge, I think feels important. So I think it depends though. If I hadn't been doing that part and was doing more staff support on that end, which I still was doing an aspect of, I don't know if they would necessarily feel it was as necessary. I don't know.
I can just say sort of from experience that, and not working in a veterinary hospital, but just in general, especially in the school setting, but in others as well, and working in a hospital setting for humans, that the word social worker has sort of this negative connotation. And no matter how much I try to educate that I'm not social services, I'm not here to take away your children, that my job is completely different and this is my job, years and years of re-educating staff, it just, that negative connotation just never really seemed to improve. So I think that, when you're looking at working with DVMs who, not used to having social workers around really at all until more recently, whereas like in hospitals and schools, it's kind of not too abnormal, then I think, finding a way to provide some type of education where, hey, if you can educate me about what goes on in your clinic, what basics do you want me to know? And this is what I can help you with, and kind of sort of educating each other and working together as a team. Possibly.
I find that really interesting because I think it seems to be a universal negative connotation, towards social workers everywhere, unfortunately. And I just wondered, as veterinary social workers in America, are you all sort of set up as private practitioners, or are you employed by veterinary clinics or hospitals?
There's definitely been an increase of being veterinary clinics hiring VSWs.
Yeah, okay.
Most VSWs are private and then they reach out. But like, for example, I work at UTK as a VSW, and obviously I think half of us have some sort of connection to UTK right now, but yeah, it's hard to find organizations and agencies that are all VSWs. We definitely work in more of that private practice capacity.
Yeah. And I think maybe, in light of what you're just saying there, it might be more challenging for you to promote the services that you offer. Well, there is that, that sort of lack of education and knowledge around the role of a social worker. Yeah. I think can I just ask another question? Sorry, Tom. So,
yes.
You seem to be quite specialist in, promoting the mental health of veterinary practitioners. And I just wondered, what sort of tools do you give them? What sort of strategies do you give them? Do you, I don't know, just to support them in their roles? Because, through looking at the research that's coming out, and particularly in Australia as well, the prevalence of suicide amongst veterinary clinics is overwhelmingly shocking. And to hear you say this as well, that really sort of resonates me as something, obviously very, very serious. I just wondered how you do support the self-care of these veterinarians.
That's a really good question. And I don't know if I have a non-circular answer to that. So with the students, as a social worker, they're seeing the students. One of the, and I have another colleague there too. And so we see a lot of students and even some of the house officers, the interns and the residents. A lot of times in those sessions, they'll bring up situations around the imposter syndrome and where they just don't feel like they belong. And so what I try to do anyway is I let folks know, this is a tough program. These are 4 tough years, but what's going to happen is when you're graduated, you're going to have another 4 tough years, and then another 4 tough years, and another 4 tough years. And so there are always going to be tough years ahead of us. And I try to just embrace part of being human is the amazing thing of trying to be able to feel the highs and feel the lows of just being a human. And with that, then, so for sure, we're going to have our low days and they're going to basically suck. And so what I try to I have rounds with what I call veterinary social work rounds with students in the small animal rotation, in the small animal medicine rotation, in the farm animal medicine rotation, and then in the emergency large animal rotation. And oftentimes they'll talk about just situations going in and around them that they can't necessarily control, either because they're a student or because they're following the wishes of a client, or they're trying to earn a good grade from a clinician. And so the 5 questions that I go through with, and some of you may be familiar with these, or 4 questions, are with any situation, because you can use this outside of veterinary school, is you have a really, really tough situation. And in that really tough situation, what went well? Can you find something that went well? What would you do differently if you could do it again? What were you able to learn from there? What are you grateful for? Can you think of anything that you're grateful for? And then the icing on the cake, is there anything humorous about that at all that you can pull in? And what I teach them, or what I try to explain to them, and I give them personal examples, but I talk to them about how the more you practice that, instead of just going to, I don't belong here, I just completely messed up, how will I ever be a veterinarian? Instead of going to the negativity, I talk about how, we keep repeating things, our neurons will actually change, and we know that. And so instead of then the default of, man, I just do not belong in this place, then all of a sudden our default is, well, gosh, what could I do better next time? And then, what did I do well? And I did this well. And, I'm really grateful for. And so that's what it's kind of it's more of a shotgun approach to things that can, for situations in vet school and for situations outside of vet school, either in their professional career or in their families. Does that kind of make sense?
Yeah, absolutely. Because it sounds like you use a very strengths-based, reflective questioning framework, which is fantastic, and some elements of solution focus approach. So I think that, using those exceptions questions can help people put their practice into perspective, that actually there was a time that it worked, and it was a time when, there was a good outcome. There was a time when they worked really well with the family. And it sounds like you try and shift their mindset from defaulting to self-criticism to actually, let's look at the strengths in this and the positives in this and focus on that.
Yes.
Yeah, fantastic.
And then part of that strengths is just following just ACT, or action and commitment therapy, just just because oftentimes they're making decisions that maybe are not the best. And so it's kind of like, well, okay, you have a choice. We have choices. Are we making a choice that goes towards our values, or are we making a choice that goes away from our values? And I kind of just bring that up. And so if I can bring in ACT to that also, depending on the person, that is beneficial too.
Yeah, great.
So
Thank you.
those are the techniques that I use.
Yeah, yeah, great.
You know, the question was, and I think this is really important. I have had clients come to me, and perhaps you have too, where they'll see their regular therapist for life stuff, but they come searching out us, veterinary social work, because a regular therapist just doesn't get what it was like to lose a pet. And I'm shocked that there are folks in our profession that tell their clients that, well, just get another dog. It's like, oh, it's really hard to believe that happens in our profession, but it does. And so I think for sure there's got to be some for a social worker or anyone in the mental health industry to place themselves in the hospital. There's got to be some sense of this is the chaos is normal in the hospital. The level of chaos that is tolerable is much higher than the level of chaos in one's normal working world. And so if you're used to that, then that doesn't, while it needs to be monitored, it's nothing that needs to be jumped on necessarily. And then when it comes to euthanasia, I've started thinking about this, and I wonder if you folks would consider this or see if this relates to some of your situations. And this is coming from a veterinarian, so this is not as a social worker. So as a veterinarian, and I think I can speak for most veterinarians, euthanasia is when they go well. We are truly honored that we could do that for the pet. That is not an angst for us. The angst comes from, and those are those euthanasias that just stick with us forever and ever and ever, and then make us wonder about our profession, are the ones that go south. So a catheter becomes dislodged, the solution goes out of the vein, the animal is painful, there are physical, there's visual and auditory signs of that pet dying. And so those are the ones that are really, really difficult. And then I think what's actually worse than that are those pet deaths that we didn't expect. So a pet dies during a routine surgery, a pet dies during a not routine surgery, a pet dies in the hospital after you've talked to the owner about, wow, it's made a turn, it's doing better, and all of a sudden that pet dies. So those are the deaths that I think really, really, really affect veterinarians more than the euthanasias. And I'm just wondering if in your settings, if you've spoken to veterinarians, if you have a sense of that too at all, or if other veterinarians have shared that with you.
I think that's something that I've run across more than once, but perhaps very poignantly. In April, I lost my therapy dog, who had been our clinics when I was there. The one morning a week that I'm at our emergency and specialty clinic had been their therapy dog. And so there was this incredible impact that I did not anticipate, that he was there on Thursday and just didn't wake up on Saturday morning. And the grief and loss and devastation and self-worth questioning that happened from that team, that was just so heightened, because all of the sudden it felt like losing one of the team. And so it brought it a step closer. And I will say I was stunned and in many ways grateful to kind of be embraced in that way, but stunned by the reaction of the team that it was that deep, that poignant, that difficult to wrestle with.
Wow. Thanks, Krista.
I spend a lot of, sorry, turn the camera on. I spend a lot of time with my clinic. They'll call me in a lot to do the euthanasia with clients when I'm there and ask me. We have a lot of clients that have been there a long time. And we tend to have a lot of clients that let their animals go a long time, 14, 16-year-old animals that should have been euthanized a lot sooner. And it's hard because they're very angst about the fact that they're letting them go when it's beyond the point of the vets there or the technicians have no empathy anymore at this point because the animal's been suffering for quite some time and the client themselves haven't wanted to let them go. And so they want me to be the one that has the compassion, and they'll call me in to come and be with them because the vets or the staff have lost their patience at this point because they've been trying to encourage them. And I don't think it really has anything to do with me being a veterinary social worker at this point. I just happen to be old enough to be most of the staff's grandmothers at this point. And it has to do with wisdom and age and patience of being older. And that's where I think when you guys were talking earlier about sometimes with how people feel about social workers versus people, I think it's just what we end to have just wisdom of working and just living and being there. And so I tend to have more patience for some of the elderly people and explain to them. And what I find is easier to do is just talk to people about, tell me stories about your pet. When did you first get it? What was it like? And just remind them about the good times with the animal and not focus on how old the animal got or how neglectful they really were to not let the pet go when it had dignity and things like that. And then remind the staff that this is people's choices and that we're human and sometimes people can't make good choices, and let the staff know that. Because I find, and this is, I know for people, technicians, there's a high turnaround with technicians and staffs in vet hospitals. And working with staff, I mean, how do we deal with that? Because you do have such a high turnaround with technicians because of the stress level. So what do we do with that? Because I'll find somebody that I'm working with and feel like I'm just reaching them and they leave. They don't cope and they don't deal well with what's going on. So instead of learning to take the things that we give them, the tools that we give them to work it out and to get things going well in the hospital, people just leave and move to another hospital. So they just take the chaos with them and move it to another hospital kind of thing. Does that sort of answer your question or makes sense?
You know, Allison, and you bring up another good point, and I've heard that compassion fatigue go on with even students, where students are done with a client because this client should have euthanized their pet a week ago or so. And what I don't know how effective this is, but it works for me, although it's taken a really long time for it to work for me, is the fact that we all have different values. And so I know that when I come to work, my value is to be as compassionate as I can to that animal. And so I know that even if that animal is just fur on bones, I can still treat it kindly, and I can rub its ears, or I can place my hand on its chest and just be completely compassionate to it. And those are my values that no one can take those away from me. And so if I stick with that and I respect someone else's values, and it's like, you know what, they have different values. I can't put myself in their shoes. They're afraid, they don't know, they're lonely. Like I don't know what their story is. So I am going to just stick with my values. And,
right.
and so if we can, I try to reframe it for the students, because what you described, gosh, that really does happen a lot. And it doesn't, it's detrimental to the client, and it's detrimental to the veterinarian or the technicians, or it's everyone in the animal hospital. And then that pet may just not be getting that compassionate care it needs, until that moment. So yeah, good point you brought up.
Well, and I always feel that, what do we say about veterinary social work? It's the animal-human bond. And so that last minute before that animal goes, they have to have that bond. And that's what their owner needs, regardless of how neglectful we may have felt they were or whatever. Our job is still what's in the best interest of that pet, which is that animal-human bond. And we want that last minute, when it takes its last breath, that it should feel that comfort. And there's that zen to whatever we do with that animal-human bond. And that's what I try. We talk about it being values or whatever it is, but that's what I feel is our value that we want to try and bring as social workers into our practice. And what we do is be able to bring that comfort or that zen or that value that we want to have. And that's where I feel that I try and bring that into the practice with me and teach that to people to help eliminate that chaos for them, and give that to the clients, regardless of what the technicians or people may feel, that we're just there. That's kind of what social work is about. It's that self-determination thing and trying to find a way. Those are all our values that we get, and we forget when we went back to our BSW and then we do our masters and all of that. We have to remember that we're trying to allow people to do that self-determination kind of thing. And I find that people ask me all the time, how can you be in there doing the euthanasias? And I find, how can we not be doing them if that's what the animals need, kind of thing too. So it's not something that we can't not do either. So, and I want to ask you a question. I've been doing a lot of studying about behavioral euthanasia, because it's something that connects me to the bees, because the bees do a lot of cleaning out. This is one of the things I love about the bees. When the bees are done with you, especially the drones, the male bees, they don't take them into winter. They're done with the male bees when we're done with mating season. So they just throw all those boys out, and you're done. They throw them out. They don't feed them anymore. They don't do anything with them. So we just remove them. So with behavior euthanasia, I've been doing a lot of reading about that, and people think it's a terrible thing. But there comes a point sometimes with an animal, especially with the behavior aspects of it, especially in rescues and things like that, that you can go so far with an animal, and especially if there's, a bite thing going on, or you get a rescue that, with all the rescues that we have going on, we don't know where animals come from. Someone might get a puppy that was severely abused and nobody knows it for the first, 6 months of its life or whatever, and someone hangs on to it. How do people feel about behavior euthanasia? What happens for us as social workers that we're in a clinic and we're working, and it comes to a point where a family does do a behavior euthanasia and they feel like they failed the animal, but they don't know its history and its background. And they're getting them from a rescue and no one's told them that. And I'm reading a lot about what people are finding out after 2 years of working with an animal. And then finally they do take it in for behavior euthanasia, or they come across a vet that won't do a behavior euthanasia for them. Do you run into anything like that?
Are you asking me or the group, Allison?
In general,
I'd like to hear
anybody.
from the group, actually. It'd be kind of cool. See what they say.
Just the group in general. Have you guys started hearing about behavior euthanasia?
I'm not a veterinary social worker. Oh, sorry. I just want to jump in. But I had a client who I have a sneaking suspicion that she had one of her dogs euthanized due to behavior. She had told me that her veterinarian suggested it. And I think that the guilt she was feeling about being judged by other people, she started saying, oh, he's going to go live on a farm. which made me feel like I was a kid. And my parent was telling me, Sparky lives on a farm now. So I don't actually know if she had her dog euthanized or not. I kind of just have to assume that she did, but I have been hearing more about behavior euthanasia being more frequent. I'm part of a Kentucky Forest Free group and they advocate for it. It's just such a controversial topic because it's so emotionally charged. So it's really hard to pick a side or even be on the fence because you flip-flop all the time because some stories are compelling but you still feel terrible. But that's my experience. I'm not a vet. But yes, I've been hearing about behavioral euthanasia more frequently lately.
I was just going to share. Oh, sorry, Wendy.
Oh, you go. Okay.
Not as a social worker, but as a friend who had to do it, and the amount of shame that she felt from other people who lashed out at her. I mean, her close friends and family, supported her, but it was a younger dog that was rescued. She didn't know exactly what happened. They think they found it like tied to a side of it, on a tree. And she tried everything. She went to multiple behaviorists. She went to multiple veterinarians, got all these extra, she tried everything, but she's had a lot of non-supportive people give her some backlash over it. So
I've also worked as dogs and cats behaviorist, and I've had my own, how do you say that in English? Dog school, but for men trailing. Yeah, no. It were lessons but 1-to-1, and I had a little school, but there were two students, strange word, but that had dogs who were genetically, that are people who are searching everything out and want to do everything well. And then there is a breeder, and that is breeding with anxiety into some lines. Oh, I'm really tired. And I'm not good in English. And a taller retriever and a white shepherd. And that people, and they are asking everything from you because you're a 1-to-1 and you're working in the forest, and it's very intimate. And they did so much. They went to the only veterinarian behaviorist in Holland. It's the other side of the country, and both dogs become, and she said that, become more and more anxious, and in the end they will be anxious for the how do you call it, the parent, the owner.
Oh.
And that was what happened, and then they had to put their dogs asleep. It's that the only thing they can do in the end was the men trailing, because then the dog can concentrate some natural drive. Oh, it's difficult. I hope you understand me, because my English it's difficult, but I can really almost cry now, because that people tried so hard, spent so much money, and the breeder is just saying, one of the breeders is just saying, oh yes, it was just a mistake. So and that people someone says just take another dog, but both of them, they have another dog, and it's a dog without problems. And that's exactly what I what's the word? I want for them. Just years without all that scanning and trouble, and but it's really very, very heavy for people to live with a dog like that, knowing you will not grow old. Yeah.
It is emotionally and physically exhausting when you're dealing with any type of behavior. It's 24/7, walking on eggshells. It's exhausting. Yeah.
Before this work, I did work with at-risk youth for behavioral issues, where they would be physically aggressive. They would be in and out of the legal system. I mean, some of these were 13-year-olds, 16-year-olds, and there were very similar conversations with the families of, what can we do for your kid? Is incarceration the safest option for you, or is it you send them off to rehab or residential treatment? So there's very hard conversations, but they're also very similar of whether it's a human child or a pet child. And I think at the end of the day, validating and making sure that safety is the top priority. But yeah, it like Tom said, it's just draining on all avenues. And at the end of the day, sometimes all you can do is just validate, and it sucks. It does. Like, I've talked to many parents, I'm like, it just sucks. And I'm sorry that you have been dealt this hand. Yeah.
You know, I have this conversation with just a select few people if I think psychoeducation will help out. But if any of you are fans of Bruce Perry over out of Houston, Texas, he's a psychiatrist. So Bruce Perry is as Brene Brown is to us. So he is pretty amazing, wrote the book, The Boy Who Was Raised as a Wolf. So he essentially talks about how the brain in utero, if the mom and or her environment is stressful, that baby's brain grows up under those stress hormones. So that baby, to no fault of its own, is never in a calm state. It is born in an alert or in a panic state. And so for those children, and I believe for those dogs out there, so if those dogs are raised in utero in a stressful situation, in a neglectful situation, there's no reason to believe that those brains aren't developed under high levels of cortisol and stress. And so the neurons, that frontal cortex just does not develop, doesn't go beyond that midbrain. And so that's where we're having, I think, a lot of issues with children and with those dogs. And it's just really, really sad that folks don't look at what's going on in utero and even 2 or 3 generations beforehand. But I guess that's another whole topic.
That's a fascinating conversation, because I mean, we look at the attachment theories with humans and how they're able to have that attachment with animals. Like, that could be a whole research thing in itself. Yeah, that's great.
You know, and I know, oh my gosh, it's 9:03. So that means it's 3:03 for you, Wendy. And it's 2:03 for you, Rebecca. Oh my gosh. Okay. I hope you don't have to work tomorrow morning early or this morning. I want to be respectful of time. I'm just here to wish you well. And it was so nice meeting you and chatting and learning from you. So if any of you are going to be attending the summit in October, I look forward to that.
Yes. No. And I'll be sending out. Oh, go ahead, Rebecca.
I was just going to say, as a newbie to this, I just want to thank you. This has been extraordinary, and I've absolutely loved, having this conversation and just connecting with like-minded people, I think. So thank you.
If everyone's okay, I am glad to send out an email. I know Jenny takes really great notes. I did not today. I got too caught up, but I will send out an email just kind of connecting everybody, especially the ones joining us. And if you need any connection, like you have a lot of networkers, I know Lisa loves to network, but also with the board, if you have any questions or need any sort of direction to go in this field, please reach out at info@iavsw.org. Love to help, and follow us on Facebook, newsletters, all that good stuff. And we're always here. That's what I love about this field. We're very open for networking. So thank you guys so much for joining us tonight. Sleep well. We'll see you guys next month.
Good night, everyone. It was a pleasure. Thank you. Good night.
Thank you so much. Thanks, Tom. Good to see everybody.